Good evening. You are with the Urban Debate this weekend. Many thanks for being with us. I'm Sahar Zaman. Tonight, we're going to take into account a scathing word, a stern word, and a set of scathing observations here that have come in for the central government of India here. This is with respect to its mishandling of the second wave of COVID-19 and the reasons why it has blown up in our face in this manner. One is an editorial piece that has come in from the International Medical Journal, which is Lancet. It says, it in fact predicts, basis a report here, that if the spread and the infection continues at this rate of what India sees today in the second wave, we could be staring at a total of 10 lakh COVID deaths by the month of August this year. A lot of corrective measures that the government of India needs to take is what Lancet has indicated. The second being a letter, a very scathing and angry to the extent of being helpless as well, a letter that has come in from the IMA, which is our India Medical Association here, asking the government of India to wake up from its slumber, taking into account some of the suggestions that have been made by the IMA to listen to the medical community. Some uncomfortable details here. Let's get you those details on what has first been mentioned by the Lancet report. Some takeaways here in what has been said. Now, Lancet says, despite warnings, super spreader events were allowed. It has also commented on our vaccination drive here, that India's vaccination plan slowed and then fell apart. It is only less than 2% of our population which has entirely been vaccinated, fully vaccinated, meaning those who've gotten both the first as well as the second shot of the vaccine. The jab policy changed suddenly without discussing it with state players, without discussing it with state governments. And the government's intent was more focused on removing criticism rather than tackling the virus. And until April, our COVID task force had not met in the past several months. So these are some very detailed observations in this Lancet report here. But let's also get you what the IMA says in its latest letter that it has written to the government of India. It has requested the government to put in a national lockdown and prepare for a national lockdown here, because individual curfew restrictions, lockdowns by state governments in a scattered manner are not working. Have a well-planned national lockdown that will work on ground. The centre has also failed to make a roadmap for the vaccine stock. Why not use the allocated 35,000 crores that were allocated in the union budget and put it to use for 200 crore doses, saying that this money is enough to buy 200 crore doses of vaccine? So why hasn't that happened? Where is the money being used? The government must ensure equitable vaccine distribution as well. This is with respect to a relook on vaccine pricing as well as vaccine policy. 15 days of crisis which has still carried on. This is with respect to the oxygen supply, the oxygen shortage. Why hasn't the government not been able to resolve this as well? And shockingly, they're saying that the health ministry did not speak to us, did not speak to modern medicine experts. These are some very, very valid points here being raised. A lot for the government of India to answer here. Will it really accept this as constructive criticism? In what manner should the government of India relook in all these points that have been made? If India really ignored these warnings with respect to the impending second wave here, what are these corrective measures that our government needs to take today? Let's take this across to experts here with us. We have with us representatives from the BJP first, Ms. Renu Bhatia, spokesperson of the BJP, Dr. Ajay Kumar, who's the spokesperson of the Congress, Dr. Jayalal, who's the national president of the Indian Medical Association. Well, first I'm going to go across to Dr. Jayalal here. This is with respect to the IMA letter, interestingly corresponding here with the Lancet report as well, which has just been released. I'm going to go across to the doctor in just a bit here. But first to you, Ajay Kumar of the Congress. Ajay, are you in agreement with what has been highlighted, stated, listed, both by Lancet as well as our own IMA?
Look, sir, I'm a doctor by education, and I firmly definitely believe what the IMA said is very simple, very clear. uh, very categorical. And those are, things which any normal person with basic common sense would say. One was lockdown, one was oxygen supply, the other one was the honesty of the records in terms of people who are getting infected and who are dying, vaccination and medicine, right? Now, all these issues, the government has changed this, and India is actually right now looking at a leaderless central government. There is no direction wherever you go to any discussion or at least on the TV debate. The only thing I hear people saying is state governments will decide. State governments will decide. So the basic issue, what the IMA said is lockdown, and we've been saying that oxygen supply, death records, and people who are unwell, their records should be transparently shared, because reports across the thing that we are hiding those numbers, and hiding also makes us complacent and doesn't make us take action. The fourth most important part is the vaccination. I think the vaccination, we need to make sure that there is a single procurement by the government for the vaccination. And the same for 45 and above.
Right. Ajay, we were getting the gist of what we're saying here, but apologies for that interruption. We're having a bad audio connect. I think the echo is too loud. We're going to be reconnecting with you on that in just a bit here to take your points as well. But we're also connected with Dr. Jayalal, who's the national president of the IMA, from which we've just heard this, read out the big takeaways of this very scathing letter that has now once again been written to the government of India. Dr. Jayalal, you have raised various points, you and your team of doctors at the IMA, representing a maximum number of doctors from across India. There is a sense of disappointment but also desperation, where you say that a lot of your suggestions are not heard, thrown into the dustbin, and the government needs to wake up from its slumber.
Yes, absolute, because we are daily seeing the cases dying in front of our eyes. The number of cases which we are seeing with the COVID positiveness, and with great desperation, people are dying without oxygen, people are dying without the drugs, and our beds are overfilled. We are not able to provide the beds to the people, and this is hurting us a lot. And for this, we have anticipated and we have explained to the government in many times, and we have returned to the government, and we have had a conversation with the government officials, and we told them, and unless we do something concrete at this time to break the chain and have put some stop to the way in which the cases are rising, and we will be in a very disastrous situation. But unfortunately, honorable, the government was not happy. Probably they have some reason. They have reason for the economic well-being and the overall well-being of the people. They have sufficient reason to say there is no lockdown. But on the medical point of ground, and when we are seeing that this situation is going beyond our level, and definitely we will say the lockdown would have helped us little to reduce the number of people coming into that. Not only that, it is going to help us in treating the people, but recouping our hospital, empowering hospital with the more oxygen beds and more sustainable development of the oxygen, and streamlining the drugs. All this would have been happened with the lockdown possibility, but we have missed that target. And that is on the one side, and the other side also equally, when we repeatedly impressed upon the government on the need for the vaccination for all. It is absolutely chaotic situation today. Whatever the Honorable Prime Minister has assured, it is not happening. That is what hurting us. Who else has to give an order? If the Honorable Prime Minister is giving an order, from May 1st, everyone with the above age 18 has to be done. And if that is not happening, an absolute failure is on the part of the bureaucrat and technocrat, and we should own responsibility. And if we have not responded to our Prime Minister, and that is a desperate situation in which Indian Medical Association is saying the ministry is under slumber.
Yes, the ministry, the health ministry, the government of India is under slumber, is what the IMA, the Indian Medical Association, very strongly feels here. Let's get in Renu Bhatia of the BJP. Renu, thanks for being with us here tonight for this. It's not just the Lancet study which is often shot down by representatives of the National Party or the government of India, saying that this is an international journal here, it doesn't understand ground realities. But even the Lancet study has raised very pertinent issues, along with concerns coming in from our own Indian Medical Association. The Lancet study also raises an alarm that if India continues with this rate of infection and spread of the virus and the range of mutations that we're looking at here locally, we could perhaps, unfortunately, if we don't put the brakes on this, we could see a total of 10 lakh COVID deaths by the end of August this year.
Sahar, no doubt, day by day, this situation is becoming worse due to this corona thing. Every day, the rate is becoming higher and higher. The death rate is also increasing, no doubt. But on the other hand, you will find the government is working in her rapid speed. If you see, so many meetings are being organized by the PM. He's taking meetings with the IMA, going for the meetings with the officials in the medical line, with the people in the ministry also, just to make the situation in a balanced manner. So it is not that the government is not working in any part of it, or it's giving any leakage to any part or any line for this particular purpose. I think the government is working hard for it. You've also watched and you've also shown in your media for last 3-4 days that we've got so many containers from outside also, whether it is an oxygen cylinder thing to be brought to India, or any other medicine or vaccine, or it is so many things of the medical use.
No, but Ms. Bhatia, that's the question. There are being string of meetings here, but nothing's reflecting on ground. And when you say that the government is sitting with doctors, this is the IMA, the Indian Medical Association here, saying that the health ministry is not sitting with us, it's not listening to our expertise, it's not taking our suggestions. Even as far as the lockdown is concerned, the lockdown is something that was mentioned by the COVID task force the previous weekend, when the Prime Minister had a string of meetings, and we're still not looking at a national lockdown, even when many are saying that this is the need of the hour. These scattered restrictions and lockdowns by individual states is not going to help. We need a national lockdown.
You're right, we do need a lockdown, and it has been decided in so many different states. See, so many states are being shut down for last 7 to 10 days. And I think it will continue also for next another 15 days. Maybe this will be decided very soon, seeing the position in the area. And I'm very surprised how Dr. Lal, I mean, it's on air. He's been giving his all the things that we're not looking after the medical reports or whatever problems they are facing. But I feel you have been showing, the media has been also showing that Prime Minister is regularly with the meetings with all these medical people, whether they are the officials or the IMA people or the other part of the medical line, to solve this problem as soon as possible and to make it in control as soon as possible. We can do that. And so many things, whatever they demanded, whatever the demand of the medical line was, is being imported from the other countries also, so that we immediately are in stop with all this kind of coronavirus problems.
No, is this a question of being in denial once again? Let's take in that aspect as well, because this is what both Lancet as well as the IMA reflects here, that the government is not listening. And why are we not listening here to constructive criticism? Because this is not with any selfish intent here. This is at the end of the day wanting to save lives, wanting to rescue India, so to say. Ajay Kumar, you were also making a point before we got disconnected there. As far as the vaccine pricing disparity is concerned, the oxygen crisis, which has been 15 days running now, to the extent that various high courts have heard it on a daily basis, the Supreme Court has heard it on a daily basis, but no results showing on ground. Today, the Supreme Court had to set up a national task force, hopefully thinking that their recommendations on oxygen procurement and distribution would be taken up by the central government.
Look, why we are saying that this is a huge mismanagement. It's like Ms. Bhatia said, medicines, oxygen, vaccine. India makes enough medicines, enough vaccines, enough oxygen. All this is not a shortage at all in India at all. Now, because of this monumental mismanagement by the central government, and Prime Minister has to take responsibility. Vaccine, we are the manufacturer in the world. Oxygen, we are one of the largest manufacturers. Medicines, remdesivir, we export to other countries, and we have a shortage. Now, I'll come with one simple issue on how this government thinks. Right now, you showed the Prime Minister talking in a WTO function, asking for compulsory licensing of the vaccines. In India, they have not done it for Bharat Biotech. Now, look at the double standard. Bharat Biotech vaccine, the intellectual property can be given to the other vaccine manufacturers. And we have the temerity or the audacity to ask other countries that you must allow Pfizer vaccine and all. You're not doing it in your own country. Second issue, whether this government refuses to believe it, 91 lakh people took part in the Kumbh Mela. And in Vidisha, out of 61 people who came back from Kumbh, 60 had the coronavirus. Now, this government is responsible for why do you think everybody is saying that the Prime Minister and the BJP are the super spreaders? Because whether it's the election, whether it's the Kumbh, we have never been honest. And right now, when we're giving a feedback, we're saying whether it's a lockdown, whether it's a vaccine shortage, whether it's oxygen shortage, people are not dying due to corona. They're dying due to mismanagement. Mismanagement of oxygen, mismanagement of facilities, mismanagement of vaccination. And if we don't vaccinate the whole of India, the mutant variants will continue to be endemic, and we will continue to put not only India at risk, the world at risk. Now, why doesn't this something so simple?
All right. I know, Renu, that you want to step in at this point here, but taking some of these points raised by Ajay to Dr. Jayalal as well. Dr. Jayalal, do you think that the announcements that came in for allowing religious gatherings, for allowing the election campaign and the state elections was partly a week, one or two, almost corresponding with the start? With the start of the second wave here, we went into it full gear despite a second wave that was also increasing in number.
Yeah, on medical ground and medical point of view, I fully support that view because when we started, already the elections were called in. But when we know that second wave is rapidly coming into our country, the patient's load is rapidly rising, and that time the corrective step would have been taken. And they should have stopped it. They should have gone back and say that now at this moment it is not possible for us to go ahead. But that decision was not taken at appropriate time. So for that now we are paying the price. Since we were not able to be on the forefront, on the tiptoe, and seeing the things and how it is coming, developing, and we are not able to take a decision quickly, we let it go, and now we are reaping the price for that. And absolutely, that was one of the reasons which has fueled this rapid spread of this disease.
Yes, Renu, you wanted to step in at this point here. Now, given the fact that this has already gone out of control, this has gone in to a point here that we still don't know where our peak is. If there is a prediction of reaching almost 10 lakh deaths by the month of August here, it means that perhaps this could continue to increase. We are still looking at a daily caseload of 4 lakh positive cases reported per day. Today, in fact, in the past 24 hours, we have reported our highest death toll of a single day ever that has been reported in the pandemic. The expectation from the government now is to accept that some mistakes were made, some huge mistakes were made, and there need to be corrective measures which should work on ground immediately, not take a stretch of 15 to 20 days to work.
Yes, sir, you're very correct that this pandemic is going very rapidly. It's increasing, spreading very rapidly. But on the other hand, if you see the government working, government is doing its best to make a stop measures to all these kind of problems. If we talk about medical things, whatever had been decided by the officials of the medical line or the medicine people, in the meetings earlier been held by the Prime Minister's office. They are being organized as soon as possible. You must have seen and you have noticed that whichever meeting goes on in one day, the second day, whatever has been asked for the medical by the medical people for the public needs, they have organized it immediately in 24 hours. And I think government is working rapidly for all these things. But if this
no, but Renu Bhatia, what's stopping the government from announcing a national lockdown here? Notwithstanding the economic losses, sadly, that would be a price that we would need to pay. But expert opinions that are coming in from across the board. The talk of national lockdown came in last week as well. It has been 7 days. There's still no announcement here. There is still no announcement to prepare for a national lockdown here because individual state lockdowns, state curfews are not working.
See, last time when this problem had, this problem was in 2020. You remember we had immediately announced the lockdown all over India. The same people who just now they want lockdown, you've been showing, I don't want to go in that political problem and issues. You must have seen those same people, that time they never wanted lockdown and when it was compulsory. And now it has been we are trying to manage that.
No, but Ms. Renu Bhatia, there is a misunderstanding to that. The demand is for a planned. This is what the IMA is also saying, that there needs to be a planned national lockdown. Give a few days notice. Last time's lockdown that came in suddenly. So people now, of course, are asking for a planned national lockdown. A few days notice here till that national lockdown is announced. Ajay Kumar, would you like to step in at this point here? Because this is a 360-degree perspective here on the issues being discussed, every single aspect to the fallout of the COVID crisis, which has been mentioned both in the IMA letter as well as the Lancet report. The Lancet report going to the extent here, given that it is an international medical journal, it would keep itself restricted only on technical grounds. But it is even the Lancet editorial which very, very categorically says here that the government has been looking away. The government needs to wake up. It is for the central government to handle this at the end of the day instead of blaming this on anyone else right now.
Look, in what Ms. Bhatia was saying right now, the opposition was exactly for the unplanned lockdown. When we locked down last year, we left all the migrant workers and then created a bigger misery, which would it was one of the most unkind, unfair, and unjust act by any government post-independence, where 3 crore people were put on the road and walked 1,400 kilometers. So there's no debate that was a very bad deal. So let's see. Planned lockdown is obviously what everybody's saying. The Lancet is spot on. The IMA is spot on. And look, the Indian Medical Association, the Lancet, is not a political organization. This government has to stop listening to IT experts and start listening to doctors.
Absolutely.
Start listening to health experts.
Ajay, we got your point that you're asking for a planned lockdown similar to the IMA. I need to very, very quickly touch upon the vaccination drive here and the cost to it as well, what the IMA has mentioned. In fact, Dr. Jayalal can answer this here. Is there a sense, Doctor, on what has been announced as the union budgetary allocation, 35,000 crores for COVID-19, for the vaccine, is not being used entirely? Because that's what the IMA letter states as well, that there is enough money to buy 200 crore doses here. And why hasn't that been done?
Yeah, absolutely. See, when we know in the budget, 35,000 crore is allotted only for the COVID vaccination. The India is purchasing the COVID vaccine at the cost of 150 rupees from the Serum Institute and both the BioVac also. That means to purchase just 200 crores of the dose. That is the maximum dose we want for the 2-dose vaccination for all 18 years of age group. That only costs 30,000 crores. Still we have 5,000 crores for other administrative purpose. And when you have allotted the fund, the parliament has approved that budget. And it is the duty of the government to spend that money only for the vaccination. And why they are not doing that? Why they want to relinquish their responsibility and say, we will be taken by the state, it will be taken by the private practitioners. We are not getting the vaccine. Last 10 days, almost all the private practitioners in the country is not getting the vaccination. People are standing on the queue. And what
Absolutely.
response we are going to say to the
And
people?
why is the vaccine shortage there? There's a shortage in testing and tracing here as well. It seems every aspect of fighting the COVID-19 seems to have collapsed. And this is not anyone saying it. These are expert voices here that are saying this time and again in the form of these documents that we've raised today and highlighted with the takeaways. We appreciate our experts, our guests, with being with us here tonight. It's important here to also note that this is not about government criticism. This is not about slamming the government or blaming or shaming the government. This is, at the end of the day, to highlight it in the form of constructive criticism and to have every aspect and department of the government to take this into account positively and bring in those corrective measures as an emergency. Thank you for being with us tonight.